Have you been putting off your first mammogram? We understand that you might be busy or even a little afraid, but mammograms can find breast cancer early, sometimes years before symptoms appear. This can increase your treatment options and improve your outcomes. So, make that appointment and we'll tell you everything you need to know before you show up for your first mammogram. First, schedule your mammogram for a time when your breasts are not likely to be tender. Don't use deodorant, powders, or perfumes the day of your mammogram because tiny particles from them could be visible on the X-ray and may cause confusing results. When you arrive for your appointment, you'll be asked to remove your clothing and jewelry from the waist up and change into a gown. Next, you'll go to a room with a special X-ray machine used for taking mammograms. The technician will show you exactly where to stand and where to put your hands on the machine. She'll then lift one of your breasts onto the platform of the machine and lower a plastic plate on top. Your breast will be squished between the two plates. Your breast has to be flattened in this way for a few reasons. It evens out the thickness and permits the X-rays to penetrate the breast tissue. It spreads the tissue so it's easier to spot tumors or other signs of breast cancer. It holds your breast still so the X-ray will be sharp and clear. Having your breast flattened like a pancake can be uncomfortable or even hurt a bit, but it only lasts a few seconds. When you're in position, the technician will take the X-ray and then reposition you to get an image of your other breast. When both breasts are done, the technician will review the images. If the images aren't clear, she may have to retake one or both of them. The process takes only about 15 minutes. Your mammogram won't be read right away. That will be done later by a doctor called a radiologist. You should get your results within 30 days. If your mammogram results are abnormal, you'll be asked to do some follow-up tests. This could include another mammogram, an ultrasound, MRI, or a biopsy, which means a small amount of tissue is removed from your breast and tested to see if cancer cells are present. Keep in mind that an abnormal mammogram does not always mean you have breast cancer. In fact, fewer than 1 in 10 people who have an abnormal mammogram have breast cancer. Now that you know what to expect, it's time to schedule your appointment.